Hypoparathyroidism. Hypoparathyroidism is an exceptional condition wherein your body delivers unusually low degrees of parathyroid chemical, PTH. PTH is vital to managing and keeping an equilibrium of two minerals in your body, calcium and phosphorus. The low creation of PTH in hypoparathyroidism prompts strangely low calcium levels in your blood and to an increment of phosphorus in your blood. Enhancements to standardize your calcium and phosphorus levels treat the condition. Contingent upon the reason for your hypoparathyroidism, you'll probably have to take supplements forever. Indications. Signs and indications of hypoparathyroidism can include shivering or consuming in your fingertips, toes and lips, muscle hurts or spasms in your legs, feet, stomach or face, jerking or fits of your muscles, especially around your mouth, yet additionally in your grasp, arms and throat, weariness or shortcoming, excruciating feminine periods, inconsistent balding, dry, coarse skin, fragile nails, misery or nervousness. When to see a specialist. In the event that you have signs or manifestations related with hypoparathyroidism, see your primary care physician for an assessment. Contact your primary care physician promptly on the off chance that you have a seizure or experience issues relaxing. These can both be complexities of hypoparathyroidism. Causes. Hypoparathyroidism happens when your parathyroid organs don't emit sufficient parathyroid chemical. You have 4 little parathyroid organs in your neck behind your thyroid organ. Components that can cause hypoparathyroidism include neck. A medical procedure. This most basic reason for hypoparathyroidism creates after unintentional harm to or evacuation of the parathyroid organs during medical procedure. Neck. A medical procedure might be done to treat states of the thyroid organ, or to treat throat or neck malignant growth. Immune system sickness. Now and again, your insusceptible framework assaults parathyroid tissues as though they were unfamiliar bodies. Simultaneously, the parathyroid organs quit creating their chemical. Genetic hypoparathyroidism. In this structure, possibly you're brought into the world without parathyroid organs or they don't work as expected. A few kinds of innate hypoparathyroidism are related with lacks of other chemical creating organs. Low degrees of magnesium in your blood. Low magnesium levels can influence the capacity of your parathyroid organs. Ordinary magnesium levels are needed for typical creation of parathyroid chemical. Broad disease radiation therapy of your face or neck. Radiation can bring about obliteration of your parathyroid organs. In uncommon cases, radioactive iodine treatment for hyperthyroidism may prompt hypoparathyroidism. Risk factors. Components that can build your danger of creating hypoparathyroidism include ongoing neck. A medical procedure, especially if the thyroid was included. A family background of hypoparathyroidism. Having certain immune system or endocrine conditions, like Addison's infection, which causes an abatement in the chemicals your adrenal organs produce. Confusions. Hypoparathyroidism can bring about different entanglements. Reversible entanglements. Coming up next are because of low calcium levels, a large portion of which are probably going to improve with treatment. Cramp-like fits of your hands and fingers that can be delayed and difficult, or muscle torment and jerks or fits of the muscles of your face, throat or arms. At the point when these fits happen in your throat, they can meddle with breathing, making a potential crisis. Shivering or consuming sensations, or a tingling sensation feeling, in your lips, tongue, fingers and toes. Seizures. Distorted teeth, influencing dental lacquer and roots, in situations when hypoparathyroidism happens at an early age when teeth are creating. Issues with kidney work. Heart arrhythmias and swooning, even cardiovascular breakdown. Irreversible entanglements. Precise determination and treatment may forestall these confusions related with hypoparathyroidism. However, when they happen, calcium and nutrient D will not improve them. Hindered development. Moderate mental improvement in youngsters. Calcium stores in the cerebrum, which can mess balance up and seizures. Obfuscated vision because of waterfalls. Anticipation. There are no particular activities to forestall hypoparathyroidism. In any case, in case you're booked to have thyroid or neck a medical procedure, converse with your specialist about the danger of harm to your parathyroid organs during the strategy. Your PCP may decide to test your calcium, parathyroid chemical and nutrient D levels and have you start supplementation if necessary before medical procedure. Given that you've had a medical procedure including your thyroid or neck, watch for signs and manifestations that could show hypoparathyroidism, like a shivering or consuming sensation in your fingers, toes or lips, or muscle jerking or squeezing. In the event that they happen, your primary care physician may suggest brief treatment with calcium and nutrient D to limit the impacts of the problem.